Welcome, friends. Revise with me in continuation the homeopathic remedy Spongia tosta. As you recall, its common name is roasted sponge, belongs to animal kingdom, and its family is Colentrata. Remedy was proved by Dr. Henneman, and here we are dealing with part 2b clinical. The text is definitely from Allen's keynote, and it is a very good study for BHMS students, interns, and practitioners at large. You will find we have taken up this particular reference of clinical application from Dr. K. N. Mathur. Mathur sir has been a very great teacher and profound writer of homeopathic literature, which is highly, you can say, prized possession of the profession. And when he talks about the clinical aspect of Spongia tosta, then we find that the Spongia tosta emerges as a precise and dependable remedy for certain well defined conditions. Dr. K. N. Mathur outlines the following key areas where its action is most specific, and you will find now how we are going to take up the text as he has given us. I am Dr. V.K. Chauhan. So he tells us about the specific indication of this remedy, but he do not talk about as a constitutional remedy. He has treated Spongia tosta more of a regional remedy, having certain organic areas of organ system. The very first organ system he talks about is the heart trouble. In a classical, how the homeopathic literature goes, associated with palpitation, dyspnea, and marked anxiety and fear of death, is classical. Patient wakes up suddenly at night in fright with suffocation, and he is unable to lie down in bed. The cardiac dyspnea, worse lying down, warm room, better from warmings. Patient may be a case of rheumatic endocarditis, which is an acute condition of rheumatic fever, or hypertrophy of heart, where angina pectoris is also associated, and it is worse from ascending motion and at night. So it has two components. Number one, rheumatic endocarditis, which is an acute condition, and hypertrophy of heart, which is associated due to valvular heart diseases or rheumatic heart diseases leading to maybe mitral stenosis or aortic stenosis, where ventricular hypertrophy occurs and ultimately failure occurs. That causes a symptom of paroxysmal nocturnal dyspnea. When the patient cannot lie down, gets up because of dyspnea. It is a cardiac dyspnea. However, when we talk about angina pectoris, which is worse from ascending motion at night, etc., it points to the coronary artery disease. So let us go to the next very important symptom here. A severe form of asthma, spongia, is also a respiratory remedy. And according to K. N. Mathur, and what we also know from the keynotes of Allen's keynote, with dryness of respiratory passage, throat dry, larynx dry, dry trachea, and dry bronchi, there is seldom rattling. Rarely you will find rattling, but if rattling is there, probably this medicine is not all that effective. But you will find whistling and wheezing at times with great dyspnea, which is an indication of bronchospasm. And there is a difficult expectoration. If at all there is expectoration, it is so scanty and so sticky, and it is far more difficult to raise it, but then whenever it is raised it needs to be swallowed, and it is associated with headache, bending forward, emeral rates. Friends, the next condition is what Ken Mathur tells us is goiter, hyperthyroidism. So, goiter is a loose term. It denotes only hypertrophy of the gland, and mostly we talk about iodine deficiency goiter, endemic goiter in certain areas, or you can say it is not a toxic goiter, mostly when we study about it. But Ken Mathur specifically tells us a good remedy for goiter when there is a hyperthyroidism is present. He tells us that eyes are protruding with heart symptom, with palpitation, dyspnea on exertion, with contracting pains, faintness, anxiety, worse in warm rooms, suffocative paroxysms at night. And next most important condition, which is very well known, is sore throat. And what peculiar is, it is after eating sweet things, which is a very peculiar nature of Spongia tosta. The fifth condition is croup, and here it is with anxiety, wheezing, worse during inspiration, worse midnight, no exudation but infiltration. There is a swelling of the trachea, and because of that, there is hardly any air which can go to the lungs, and there is having a croup, a very specific kind of a cough. And this is a very serious condition, and almost invariably it occurs in children, small children, and mostly it is because of viral infection. But whenever it is present, we can prescribe our medicine on the indications as given here, but palliative treatment is must. So our medicines, they need to be complementary in nature when we diagnose croup, and it is best to be treated in hospital if it is severe form. Now we come to the cough. It is a dark, dry, barking, rasping, ringing, wheezing, whistling from dry, cold air. So whenever patient goes into the dry, cold air, suddenly there is a bronchospasm. And with bronchospasm, the trigger for a spasm is cold air. And you will have asthma-like attack where we have got lot of wheezing, whistling, which is the dry sound, rails, and it is predominantly by, and there is no crepitations, no wet sounds are present. And again, it is worse from cold weather, better from warm food and warm drinks. One more important thing which is associated with the cough, which is of this nature, is every mental excitement aggravates cough, worse from talking, singing, smoking. Mental excitement and few things like if you talk, if you sing, the condition becomes bad. Friends, the seventh condition is orchitis. It is a gonorrheal orchitis. Specifically, if you maltreat the gonorrhea, it is followed by a complication orchitis. And invariably, you will find the spermatic cord will also be affected. Next condition stands aphonia from exposure to cold. Sudden exposure to cold, there is a laryngitis, and similar symptoms you will find in case of aconite, hypersulf, and phosphorus. Then comes the ailments with dyspnea, especially on lying on the left side, must lie on the right side with head high. This is a condition which is most commonly associated with congestive cardiac failure, or you can say left ventricular failure. The 10th and last condition, which is very marked, is tubercular laryngitis. Please remember, Spongia tosta is a miasmatically pseudosoric remedy. Scrofula is being uh, attached to the children who have a scrofular conditions. And since it is a scrofula is there, the tuberculosis is the cause of scrofula, there can be laryngitis. And if it is a chronic laryngitis which is not responding to routine treatment, please remember you need to rule out tubercular laryngitis, which is chronic hoarseness. So, friends, we find that in summary, Spongia tosta is specifically spans or covers the heart symptom, larynx symptom, thyroid, and respiratory tract conditions. It is one of the most dependable clinical remedies in situations dominated by dryness, constriction, and fear laden dyspnea. So, friends, thank you very much for your patient listening, and please remember sharing is caring.